تفضل.
Hello?
أهلا. Yes, hello.
Who are you? You're
Yes,
a doctor.
I am Hamad. How are you?
Nice to meet you.
Sit, please.
I will sit.
How are you?
I'm doing well, how are you?
Alhamdulillah. Do you mind if I just know you? Can you tell me a little bit about...
You don't know who I am?
No.
So I'm coming to your office to
Actually,
be your patient, and you didn't do any research about me? What do you want to know? I made my first million when I was 21 years old. I made my first 10 million when I was 26 years old. My name is Deontay Wilder, and I'm here and I'm meant to be your patient apparently.
great. You are married, Deontay?
I'm single. No one deserves me.
No one deserves you. Oh, that means you are lucky. Or
Born-
unlucky.
I was born lucky.
Oh, great. Okay, where do you live?
Where do I live?
Yeah.
I live in Riyadh.
Riyadh. How old are you?
28.
28.
Please read your file again.
Sorry, it's my bad.
know.
Sometimes it's very hard to follow, so at least excuse me, please. Okay, what brought you here?
I don't know where to begin. So, as you know, or maybe you don't, I'm a marketing specialist. I love to make money. And I've had some issues in the workplace. They brought me here for one reason or the other, my disruptive behaviors, which don't exist. Anyways, long story short, one of my very few good friends recommended me that I come to you today to do whatever it is that you psychologists do. So that's why I'm here.
Okay, so it's like you are visiting here, you believe that there is nothing, it's just you are following your friend,
Yes.
friend advice?
Friend's advice.
Friend advice. Okay, I'm gonna ask you just a few questions, so excuse me please, and try to follow up with me. First, what do you feel about your life? Are you happy about it now?
Am I happy? What is it to not be happy? I live in a villa, a mansion I should say. I have multiple sports cars. I can get any woman that I want. I live a dream, my friend. I live a life that people would dream to have.
What about your relationship with your with people around you in work? First, let's start with the work.
Let's talk about work. My relationship is very superficial. I take what I need from people, I extract what I need to be extracted, and I leave them the rest. No one is worth my full energy. Time is money. My time is very valuable.
So you believe that like it's, you are the guy who's running the place there?
The king
and
who's running the place there.
great. Okay, what about your social life, I mean on home or on family? How is the relationship with your family?
Well, my family, I am the only son of two very hardworking parents. They tried their hardest to provide for me growing up, and they were very busy. But it was clear from a young age I was an exceptional person. I excelled in sports, I excelled in maths, I excelled in many, many different things that you can only imagine. Many people wish to be like me, and people are very envious, and I think that's why I'm here today, purely because of jealousy from my workplace.
Jealousy from your place. What about your brother? Are they?
I said I'm an only child.
Oh, okay. Sorry, I heard.
It's okay.
It's okay. Thank you for clarifying that for me. Okay. What do you feel also about how is your relationship now with your father and mother?
Well, they're both much older now, so I am the one that provides for them. I give them at least 100,000 reals every month. I like to spoil the people that I love. And of course, my parents are the only ones in this world that actually matter to me, because if it wasn't for them, I would have still been very successful, but they helped me when I was much younger. They're the only people in this world that has ever and will ever help me, because I don't need help from anyone.
So my question now, do you feel like they did a favor or something?
No, I don't need favors from anyone. I am the best in what I do, and I don't need anything from anyone. What I am thankful for is that they provided a roof over my head and clothes on my back when I was very young. That's it.
So you feel that you already paid them for, or let's say for what they done for you?
I'm paying them more than what they did for me, but I'm a very generous person.
Great. Okay. What about your sorry, not social life. Let's say private life. Are you having anyone in your life?
What do you mean by that?
I know that you are single, so that means you are not married, right? But I talk inside. Do you have, for example, any relationships?
I have multiple women, if that's what you're asking me.
Yeah. And how is your life with them? It's like what exactly?
I take what I need and leave the rest.
So there is nothing, let's say, special for you, right?
I'm the special one. You realize that, right?
Yeah. But I mean, You are not caring about any of them. It's sorry. Just let me
Listen,
clarify
doctor,
my question.
let me stop
I
you
mean,
right
do
there.
you
No,
love
no,
any
no.
of
Let
them?
me stop you right there. I am the catch. Any woman is lucky to be with me. I'm a multi-millionaire. I made my first million when I was 21. Made my first 10 million when I'm 26. I'm sitting on multiple properties across all of Saudi Arabia. Multiple real estate, multiple cars, multiple mansions. They're lucky to have me. I have the full package. I can get any woman that I want. It's not a challenge for me.
Okay, so let's finish from that. Let's go to your sleep pattern.
Mm-hmm.
Are you sleeping well?
I don't sleep much. Maybe I function on 2 or 3 hours of sleep. I like to work most of my time, and I think sleep is for the weak.
What about you eating well?
I'm
going to the
eating well.
gym?
I'm actually an athlete. I was a D1 division athlete growing up, played multiple sports, won junior varsity across all of high school. I achieved multi sports deals, but I went through the marketing specialist route because I wanted money faster.
I'm gonna ask you if you doesn't mind.
You interrupted me there, but I'll allow you to interrupt me. It's fine.
Sorry, it's
okay.
my bad. Yeah, sorry, but I just want to ask you. We know that most of the people, especially like you, special people, love to enjoy their life. So, are you going, for example, for the nightlife, drinking, smoking, anything, and make feel okay? Because whatever you're gonna say, it's gonna be only between us.
You understand that there's a difference in this topic and between women. What we're asking here is a very personal question, but am I
And I know you are a
confident?
very famous person, so it's okay. It's gonna be only between us.
Yes, I do have the occasional drink every now and again, doctor.
Occasional drinking, right?
Yes.
Are you smoking anything?
I don't smoke, but I do take some substances.
Okay. Do you have any hallucination or any delusion that happened from this substance?
No.
Do you mind if you tell me which kind of substance you
I
are
take
taking?
cocaine.
Cocaine.
It's a VIP drug.
VIP drug. Unfortunately, I didn't try it. Okay, so let's go to the next one. Do you have, like, for example, any idea that the life is worthless or that mean nothing for you?
In my life as a king, I'm very happy.
I'm not talking about your life, about the world itself. It's like the world doesn't deserve to have you here.
While I do agree, the world is very lucky to have me here. I am enjoying my life very thoroughly with the amount of money that I'm making and the amount of achievements that I achieve on a daily basis. Many people dream to have.
So you don't have any societal idea or anything,
Me,
right?
if the world was to lose me, it would be a despair to this horrible place. I am the reason why this world is revolving.
Okay, what about your family history? Are there any disease or anything that running in your family?
My father had hypertension, but I don't see why that's relevant.
It's okay, it's just a routine question, so don't worry about it. What about social? You already answered about it. What about the medical, surgical history? Do you have any past medical or surgical?
My body is a temple. I take care of my body very often. As you know, I'm an athlete, Division 1 athlete growing up, won multiple achievements in sports. And I like to take care of my body, which is why I don't do the smoking.
Okay. We already finished of having history for everything. Okay. Usually, some people it's like first. You know that there is a medical disease that it's called narcissistic, right?
I've heard of
Did you
it
read
before.
about it?
Some people in my workplace say that I might have it, but I think they're just jealous of my achievements. And I think they're intimidated by my confidence and what I can bring to the table, so they like to throw away these terms that I think ignorant fools like to say. Honestly, if they focused on themselves as much as they focused on me, I think they will have a quarter of the amount of money that I have.
Okay, did you read about it? Or you didn't?
I've heard about it, but I don't want to waste my time on some delinquent subjects like personality disorders.
Okay. That's all the question that I have today. Okay. Thank you for your time and thank you for giving me that.
I know it was your pleasure. It's okay.
Thank you. Have a good day. My major problem was it's like the
Would
patient.
you allow to go and sit there? Okay.
My major problem is like the patient having denial.
Sit down, sit down, sit down, sit down. Thank you very much. Full mark.
Thank you, doctor. Thank you.
You did excellent. It's really difficult kind of patient. And I really admire your, way to take all this kind of thing. besides Hamid, or even best? Both of them. Any comments?
دكتور اول شيء احمد سوى شيء منيح مع نفسه ممكن ان يعطيه البدايات يعطيه المدح بالبدايه ويعطيه الشغلات اللي بيحتاجها
You can
الشخص.
just talk in English so
Okay,
we
so
can
Hamad did very good job because he gave what person need because as a narcissist he have to give like a compliment or attention to Basim and he deal with Ahmed. وكان Basim can just leave and just not give Ahmed any chances. But I have a very small comment on Ahmed إنه when he asked about psychosis he give him psychology vocab like hallucination and delusion. وكان المفروض يعني يعطيه in another way.
defend yourself.
He was talking a lot, to be honest. You know, it's not narcissistic patient already. So I just was trying to do a time management. So during that phase, to control the time, I have to change from open question to closed question because I am working at clinic. I need to control my time.
You accept it?
بس يعني ممكن هو باسم as a patient ما يكون فهمان يعني شو يعني hallucination.
Like, look, I think this explanation is accepted because you cannot, even if you have a patient who is talkative or arrogant, who is whatever, so you need to control the setting, you know. You are responsible in the clinic to control the things, even if he is there, whoever, okay, big VIP, whatever, this is, you are the king in your clinic. And the other people, they are soldiers, okay? They should just obey whatever you are the king, you are the, okay? Any other things? Okay, you did excellent, Hamid. It's really excellent job. And one of the difficult patients, as you said, that personality disorders. Me, myself, I hate deal with personality disorders. In general. لكن عشان طبعا you have many facilitative techniques and thank you very much. You will just trying to just verify your question always. What do you mean by this? What is that? And you give some rationale. Would you why? You know that's excellent. You know you need to probe and look for the symptoms and to challenge your patient. He might well do, what do you mean? Do you mean this or do you mean that? And this sort of things. Thank you very much. Tell me about your patient.
Okay, Dante is, sorry.
But let me tell you something. Please watch your setting. Watch, we are here to learn. If you just, some people just sit like this, like his, okay, the patient, he can sit wherever, but you are a doctor, you need to watch your body language. You need to watch it. You will forget it. Hamid is okay, but he was just putting his leg like this. Maybe I think you need to change it. You know, or watch this. Don't be defensive. Just listen to me. I would like you.
لأني أنا ترى سويتها يوم هو كان اندفع في الكلام كذا. It's like checking the.
Even though you are a doctor, you are the person who's expected to absorb whatever others people. So please just take it from Muhajjad. You and I think Imam Muaz, he was most of the time, you know, just putting leg on leg and he was asking, and not most of the time, sometimes that will give a negative feedback on others. So please be careful. Watch your body language. A little bit, you know, being forward, that will give intimacy, that will give the patient that, well, you are caring, you are with me, you are not, you are the king of the, you know, of the ward, and you are, you know, just a big surgeon or big psychiatrist or whatever. That will make a barrier between you and you. Okay, please tell me about your patient.
Okay, my patient is a Dante. He's a single, 28 years old. His chief complaint is nothing. He just came to me as an advice. So he believed that he don't have any disease or anything. His sign of present illness, it's like believing he's the king by his word, in the work, in the house, in anything. He don't have. He have acceptable relationship with his family, but for the other people, no. He believed that he's higher than them. Even his father and mother, he feel like he don't own them anything. He already pay his debt on that. For the family history, the only running disease is hypertension, but he don't have any medical. From his side, he's
Do you
free.
have you finished the history of present illness?
Regarding to the
Now
other,
you moved to the physical history, right? To the
Yeah.
medical organic. So, do you think that you need to say more about the history of present
yeah,
illness?
his mood, his belief. Sorry, I'm gonna say only the negative thing. So he have disturbance on sleep pattern, problem with the
By the
sleep.
way, you don't know. You should just say some positive and negative.
Okay, great. So he's happy about his life. He's eating and training very well and follow gym protocol as he said.
You mean
Uh,
exercising.
Exercising, okay. He have some sleep disturbance. He's drinking alcohol.
About when you are talking about a game, please just drop down menu. Sleep, that means, especially with this presentation, you need to be careful about some issues like sleep. In what way? Give me more detail about his sleep.
He said he have sleep disturbance, but to be honest, I didn't ask about
Thank you
it.
very much, yes. But please, you need, with this type of patient, why? Wait, just raise your hand, but let me just give him a chance. It is premature question now. I don't want to just disturb you,
Yeah.
your way of thinking. I will respond this question later on. But you need to tell me more, of course, about some symptoms, especially if you think that this symptoms could be, just a key for this, the carnal area one. There. Some symptoms you need to be careful. If the patient, for example, he said that I have, drug problem. So you need to go, immediately open the drug and just complete the list or complete the question.
Yeah.
Well, this is what, okay, just go ahead. So,
Okay, he's having sleeping disturbance, and he's already using alcohol with cocaine,
excellent.
and he have sleep disturbance at the same time.
Of course, alcohol and cocaine, and you need, again, this is drop-down menu. But again, I don't want to disturb that. Today, who are today, Mr. Matthew? Drug and alcohol substances today, right? Who is? We'll come to that, and it's very important.
Regarding to his sex life, he just having multiple relationship with not feeling anything. It's like something that he have to do. So he's not taking anything serious. He loves his life, so he don't have.
Immediately, whenever you have multi partners or whatever, extramarital, well, it's not married, you need immediately drop down menu. Somebody who is having multi-sex here and there. Again, sex means you need to have to ask about some questions. Do you read my mind? What
Yeah,
is the most
for the infectious.
Thank you very much.
transmitted
Excellent.
disease.
That means you need to just look for any sexual transmitted diseases, and you need to ask. Do you have any what sort of symptoms here and there, and do you have, relationship with prostitutes or whatever? So that will make you feel confident that yes, tell them.
دكتور بسأل هيك ولا بسأل إذا هو safe or not؟
No, you need to make sure that your patient is safe, even if he is arrogant, if he is just, but still it is your responsibility. Even if he insulted you, Sometimes they go, well, you are whatever. Oh, okay, he's a patient, and he came to you because of he is a patient. So you need to absorb it and tackle with whatever. So still your responsibility or still there. You are responsible to make sure that yes, my suspicion that he might have AIDS, for example, he might have whatever, sexual transmitted diseases. So I will make sure, well, does he have this or that? Just one or two questions that will make you, safe physician.
Okay, regarding the hallucination and delusion, he said he don't have any of them. Regarding his childhood, he was believed that he was the lucky guy and he had no brother.
Are you talking about history or mental state?
No, until now I am talking about the history.
I'm so sorry to stop you. If you want to ask somebody about delusion, he said he doesn't have delusion, right?
Right.
How you make sure that he doesn't have delusion? I think this is very important question.
I need to ask him about his thought, if he believing on something that the other people aren't believing on it, but he told me since the beginning that he believed he's the king, he's the only lucky guy.
Thank you very much. It is not enough at all. You need to make sure that he believes that he's a king.
Yeah.
And this is a key symptom. Who other patients, or in what cases you will find the people who are saying that I'm a king.
Right.
You mean? What is the other disorders that the patients presented with feeling that he's a king?
Schizophrenia in some cases, they believing like the other.
Where is schizophrenia?
Bipolar.
مريم الغامدي. Okay. Do you want to كنا حكى okay, that's good. احكي لك على حالك لما تغديني.
الغامدي سمعت.
Okay, that's good. Bipolar, yes, of course. This is why, and please listen to me carefully. Sometimes you can diagnose by just a question, taking good history. So make sure that you are following your history properly. And I think that makes a difference between one doctor and another doctor. I have many, experiences with this in psychiatry and psychology. Just asking one question, you can just, well, no, this is epilepsy, this is not epilepsy, this is what? And again, the same things here. It is a very sensitive issue, bipolar. So I have one patient who is saying that I'm a king. Well, how can I make sure that there's delusion or not? This is very important issue. Do you know the definition of delusion?
It's like the patient having thoughts that he's the only one have it with no other.
What is the definition?
It's like I already said.
The definition of delusion, somebody who doesn't
wrong belief in something without wrong beliefs.
wrong beliefs. Whenever I ask you or anybody asks you about any definition, go from general then to the specific. It is a disorder of what?
So wrong beliefs without this.
A disorder of thinking, right?
Yeah.
Disorder of cognitive. ABC is a disorder of cognition, and this is, we classify it in psychopathology under C, that means cognitive problem, and we classify it under content thought disorder. So this is content thought disorder. So delusion, content thought disorder. This patient is saying that I am a king, and this delusion first, you need to make sure that it is clear. So the definition is yes, this is abnormal of thinking characterized by, this is just usage, just put it down. Whenever you will be asked about something, definition, you will be asked about definition. In the media or later on with your whatever setting in the grand round, and anybody can ask you about what is the definition of myocardial infarction. So you need to say what it is, especially in psychiatry if you are using. So first of all, what is in general? It is not a type of cars, for example. It is just, we are talking about medical problems. So it is myocardial infarction is a disorder, is a disease of heart. So start from the beginning, characterized by, go with a specific. Okay, that's only two ways that will make your thinking more clearer and you look, okay, you said that it is a belief, abnormal belief. Kamil?
The point, it's a disorder of thinking, cognition disorder.
Awesome. Okay, characterized by?
On something without evidence.
On something?
Without evidence.
Okay, ممكن يكون lying. لكن what I want to say is very important. Definition is, we give you how to make sure that I'm dealing with delusion or not. If you remember, it is abnormal of belief, which is fixed, more is fixed, unshakable, fixed, and the key here is unshakable. That means you will start to shake. Why you're a king? Why you have this big ability? He said, well, you don't know, or he is really, he thinks that he's a king. Okay, that means really it is a delusion. So if it is fixed, I'm a king, okay. But if it is unshakable, you cannot shake it. يا شيخ why you are king؟ طب وين الناس اللي عندك؟ طب وين الحرس؟ وين whatever? You start, you have excellent, just arguments. You have excellent, way of rationalizing things. So you can just utilize it and shake his beliefs. You cannot take it for granted. You need to shake, well, is this real delusion or valid ideas or just a thing, just, well, this is a belief and, well, no, I'm not a king, so it is not. So you will put, that what you are dealing with. عشان الوقت كمل.
Okay, he was.
But I'm sorry, I'm so sorry to disturb you, but this is really interesting case. And this is, by the way, this is the first time ever that somebody is just, doing this narcissistic disorder. Okay, can
He believing that all the people are jealous from him. Okay. This regarding to the present illness. For the family history,
you need to mention in the history, please don't forget, when things started. By the way, as maybe if you remember when I just made the classification, if this happened last week, different from 1 year ago, different from the childhood.
he said per his words since he birth.
You need to mention that.
Yeah.
In the history of present illness, you need to mention that this is since a childhood. That means you give me, by reading your history of present illness, I will reach the diagnosis.
Yeah.
So I have this professional diagnosis. Well, this is not because of cocaine he is taking.
Yeah.
So he is, no, this is since childhood. He used to have. And the other things, خلينا نكمل بس عشان
Okay, regarding to the family history, there is only hypertension running of the family. Regarding to his personal medical history and surgical, he cleared. He don't have any morbidity or any previous surgical. Regarding to his appearance, he was very well dressed.
You mean that, no, okay, this is very important. Thank you for, don't move from history to the examination without saying that, without saying so. As if you are taking me to other room and just I'm following you. You should start, and this is usually I ask, tell me the mental state examination. But like you now, examination or mental state examination revealed, tick, 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 you can just say it. Don't enter the room of mental state examination without telling me that I'm taking you to the examination, as if you are just doing any physical issue. And you cannot say immediately blood pressure on examination was so and so. So just put that makes, your presentation more impressive, more clear. Okay, so describe his mental state.
His mental state.
Revealed, just put it down. Revealed, showed something.
Yeah, the patient, first regarding to the appearance, the patient was very well dressed with strong eye contact. He doesn't taking his eye.
Eye to eye. Okay.
Yeah, eye to eye contact. He didn't take his eye out from me. He was showing well self-confidence. He was showing self-confidence more than normal people. Overconfident, yeah. Self-overconfident. His behavior, he was a little bit arrogant and uncooperative. It's like
Okay, two things. Argumentative, and arrogant. Thank you very much. Yes, for mentioning this. Okay.
and uncooperative. Even sometimes I'm asking him about a couple of things. He just wants to skip this subject and go to whatever he wants.
Thank you very much. This is very important piece of things because Hamid is expert dealing with people, with his patients. So I think he is describing in general that this is the way of the patient, or this is a kind of patient in front of me that gave me an idea. I'm listening to what he's saying. I immediately draw a picture about this patient. Come on.
Regarding his tone, he has very high tone, but sometimes when we are talking about something related to himself, he was decreasing his tone. It's like I am the guy, or I am the. But when he was talking to other people, he like feeling that they are disrespecting him, so he raises his voice of tone. Regarding to the mood, his mood is always positive, and bear what he say, he doesn't allow anyone to disturb his mood, because he believes that he needs to be always like that.
What do you mean by that? This is, big issue.
He believes that there is no one deserve to change his mood for him.
This is another thing. When we are talking about mood, what we are talking about?
His
Now
mood.
give me
Yeah, his
the
mood.
idea about his mood.
If he like, for example, negative, depressive, or whatever, or if he's
What describe his mood in one word or two words?
hyperactive.
This is not mood. Hyperactive, that means this is a behavior. This is why we are really learning the skills. Give him a chance. Mood. How can you describe this mood? Without your social skills, mashallah, you can,
اي ما بحاول بس اتوقع كانت ماني
describe his mood. ما شاء الله عليك.
بغيت اقول كلمه ما هي بزينه.
Don't say it. Don't say
Describe
it.
أحسن.
No. Describe his mood. Just we need at the end. Okay, and let's really.
He was having he was look happy about his life.
Thank you very much. When on, just talking about mood, be very scientific, objective. Is he happy? Is he sad? Is he angry? This is the mood that. This is why I told you, please memorize the vocabulary. You can say why you are angry, why you are happy, why you are sad. Why just describe his mood. It's one mood. Is he depressed?
No.
And this is another way. You can just know things by excluding. Well, is he blunted? That means no expression at all.
No.
No, thank you very much. Yes, he is full of emotion, right? So he is not depressed. He is not. Is he angry?
A little bit. people, but not from himself.
Okay, not during the interview. He's not angry. He is happy, right?
Yeah.
The best description of his mood or inflated self-esteem. This is description of mood again. Inflated. This is he has full of a pleasure. Okay, because I am a king. If I'm a king, I will be, happy.
دكتور ما نقدر نقول manic.
Manic? You cannot say manic. This is why, thank you for saying that. لكن حتى I was avoiding even saying this. I will come to the diagnosis. Okay, Kamil.
Regarding to his thought, he was believing like he's the king and everything, which is he having belief on something it's unreal.
Do you think it is delusion again? This is very
Yeah.
important.
Yeah.
Do you think if it is delusion or not a delusion? And I will come to that.
Yes,
Sorry, I will keep you
I
ونصلي بعدين, I'm so sorry about
Yeah,
that.
I
But I
believe-
think this is very rich discussion.
Yeah,
Thank you, Hamid, for tolerating me as well. Okay.
I believe that is a delusion because he's not taking this only on his personal level, even on his family and father and mother level I'm talking about. So he believes like there is nobody owning them anything in the world. It's like over self-esteem.
Look, if we are, you need to tell me, in evidence-based things. I mentioned that. Maybe you missed this during the interview. You need to shake. This is a belief. That's good. Excellent. Fixed belief, yes. If I want to make it a delusion, والله أنا, I think والله زوجتي تخوني. This is a belief. How can I make this as a delusion?
The major problem for his case is difficult to differentiate between over self-esteem and between
لا بتصلي على الرسول.
Okay.
The way, how can you differentiate إن واحد يقول لك والله I have أنا زوجتي تخوني. How you will just make sure that this is a real thing or not.
By checking.
Thank you very much. Changing, checking and shaking his beliefs. يا أخي كيف? Do you have any proof or not? This is the way I can, because it is really a key diagnostic issue. Is this patient deluded or not?
Since the beginning, he gave me already his.
Do you think that he has delusion? Okay, let us just go. Do you think that he has delusion? Yes or no? Your
Yes.
job at the end
Yes.
is to tell me that he has
Yes.
delusion, psychopathology or not. Yes.
Yes.
Okay, go ahead. We'll discuss it in the diagnosis. Can
Regarding to the cognitive, he's thinking very well. Okay. And noticing everything fine. Regarding to his
Of course, we are talking, if we want to talk to describe the thinking of other people in psychopathology, we should go for two directions. Yes, you're right. One of them is he rational or not? We missed that. We will come to the diagnosis later on. Does he have formal thought disorder
Yes.
or contemplative disorder? We need to be scientists. So you need we learn psychopathology, and we need, at the end, anybody can say anything, but show me the evidence. Okay? Does he have any formal thought disorder?
Yes.
Which is, you need to say any formal thought disorder. Do you remember my psychopathology? Because you didn't attend. Unfortunately, I understand that. You cannot say yes, formal thought disorder, because you don't know what is formal thought disorder. No, this is a specific thing. This is a specific psychopathology. When we are saying formal thought disorder means will answer. أخذت بونص؟
اليوم؟
ما هو اليوم. The total هو كله اليوم وبعد بكرة وبعد سنة هو just 2 bonuses. You took 2?
I don't need a bonus, but I can answer if
No,
no.
just let me have people who needs bonus. Okay. أحمد صح. سلمت على أبوك ولا ما سلمت؟
يسلم عليك.
خلاص بونس أخذها ما في. Okay, go ahead.
يكون في flight of ideas.
Flight of ideas. Yes, thank you very much. One of the form of thought disorder is a flight of ideas. And the flight of ideas we describe as flight of ideas. Do you know what's flight of ideas?
Like salad of thoughts. He goes from one thing to other thing that they are not connected.
Please be careful. Psychopathology books like this, believe me. Each detail, word salad or thought salad is different from flight of ideas. Watch what you are saying. حتى أبوك يعني تحكي أي كلام ما
He
بيمشي.
goes from one subject to another subject. That
Yes, you're right.
that they
But
are
it is
not-
different from word salad. Word salad في خيار وفي بصل وفي whatever. You cannot understand what he's talking about. We all understood what he's talking about. He's a king, he has wealth. This is no word salad. في flight of ideas, I doubt. Usually flight of ideas, في ideas وفي link between these ideas.
No, I'm not kind of أتكلم عن
Well,
form.
what we cannot say that. Well, he has accelerated thoughts because he has inflated self-esteem. Yes. لكن there is no
No form.
Okay. But this is the other thing. What you will, the last things in the cognitive function.
The risk, is he considered risky for himself or for the
The
other?
risk is not in the mental state examination. Under what term you said that risk? And tell me, what do you mean by? Okay, continue.
Is he considered dangerous for himself or for the others?
This is, you can say it of course, in the history. He is dealing with other people, and this is, he taking, for example, reckless behavior in the way when he is driving his car. Yes, we can say this is risk taker. Like, we don't that risk taker, and we don't describe people who is risk taker in the mental state. What is the mental state now? So what is left is orientation.
Orientation.
So 2A's, I will remind you. 2A's, appearance, affect. 2B's, behavior and perception. 2C's, communication and cognition. Cognition, we have either formal or content or orientation. Cognitive, that means proper cognitive. That means orientation and memory. Long-term, short-term and attention. Since we don't have, like, what is your diagnosis?
Narcissistic.
Narcissistic, what? We cannot say narcissistic. We are here to say the proper things. You said the proper things is, if you want to say narcissistic, you should say narcissistic personality.
Personality.
So you need to just give me, not depression, major depressive disorder, okay? Narcissistic, you will not take full mark, by the way. If you say it in the, this is, you will know. I cannot accept to say narcissist. What do you mean?
Narcissistic personality.
Narcissistic personality disorders. Prove it. Legitimize it.
Okay, the patient was medically free from anything, okay, but at the same idea, he's believed that he's the king for everything, regarding to all his sign and symptom.
It's really interesting case, okay?
Yeah, first he's feeling jealous, okay. He was feeling that he doesn't own anything. He believed that he's better than everyone. He believed that he's the special guy and the unique guy, even his family. he don't have a good relationship at the work
Thank you very
because
much. Excellent, 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 yes. And the key issue in personality disorders is the relationship. Usually he has, as you said, a bad relationship at work. Like, what is the differential diagnosis?
the differential diagnosis, bipolar
Affective disorder.
affective disorder and substance.
You cannot say bipolar affective disorder without, you need to specify. Bipolar, be careful, even in the exam, you need to be careful. Bipolar affective disorder,
Personality.
no.
Manic phase.
Thank you very much. Either manic phase or depressive phase.
Manic phase.
Okay? So bipolar affective disorder, manic phase. This is why, if you want to be silent, test, you need to be more accurate, objective to the point.
Would we be allowed to say bipolar 1 with manic phase?
It's okay. Bipolar affective disorder, just manic phase. That means yes. If I haven't seen you in the interview and just you are giving me a report, I understood what do you mean. I can see. So this description can describe this person. Okay, so whenever you will tell me differential diagnosis, you need to tell me what is with and what is against. Why not bipolar
It's
affective
sharing.
disorder?
Yeah, it's first why it's with, because it's sharing the same concept like narcissistic personality disorder, which is the over self-inflate.
Thank you very much. Yes, that's good.
Both of them having the same idea.
Okay, the same manifestation. Okay.
The same manifestation.
Okay. Yeah.
Another differential diagnosis.
You need to convince me and the people that he is not bipolar, he is not manic patient, and he is narcissistic personality disorder. If
Okay,
I'm,
first
if
that
I'm
is-
manic,
Yeah, if I think
I will have a problem at work. صح? So now I have patient. Thankfully, you said he have problem at work. تمام? Okay. Both of them they might have problem at work.
for the narcissistic personality disorder, he said that he mentioned that he had the problem since the birth. It's not something that happened.
He has the what?
The problem.
The problem.
Since he was kid, very small,
You cannot say since birth, by the way. You can say since childhood.
since childhood.
And then just to correct it here at the time. That's good. That's
Since childhood.
so that's it's not recent thing.
Yeah, it's not recent.
So if it is manic or bipolar, whatever, so it should have a start. He start, and then from that point he started to have this manifestations. So having problem at work cannot exclude mania or cannot differentiate between mania and personality disorder narcissism. Okay, that's good. Okay, you mentioned something in the كده why you said schizophrenia. You said schizophrenia. صح؟ يا حلو. الكرسي هو المشكلة في العالم.
anxiety على قولتك. احنا ما نشوفه.
You said it when I talked to you. Yes, no problem. It's okay. What you said.
Another
والحمد لله إنه
differential
شاهد من أهل السماء.
substance.
But why not schizophrenia? I don't skip.
I am escaping. Not even this time.
Why not schizophrenia? This is why we are here. This is why I tell Muhammad, yes, he is now psychiatrist. We are in the last day.
Yeah,
You might not later on face any psychiatric, or encounter with any psychiatric. Why is not schizophrenia?
I read that the symptoms is different, but to be honest, I don't know the symptoms.
Why he is not why he is not schizophrenic.
First, he's
I'm so sorry with all of you. Thank you very much.
First, he will.
ارفع صوتك عشان
First,
نسمع.
he is well dressed. Schizophrenia usually don't care about that. Second,
good.
there is no delusion, no.
عادة بيكون self hygiene is not that good with schizophrenia. That's good. One. Okay.
Then he doesn't have hallucinations.
Thank you very much. He doesn't have hallucination. And what else?
The sleep also. He, that sleep.
If you want to diagnose schizophrenia, you need what? ناس ما عندهم. أنت عندك أنت أخذت بونص 1 2 you don't know؟ لا امبارح اليوم أعطينا بونص صح؟
اليوم ايه اخذت
Appearance is poorly at least.
If you want to diagnose schizophrenia, just remind us. You have tried of schizophrenia.
Severity symptoms.
Forget about it. Just type what type of symptoms. Yesterday we said it. Maybe after. Right.
positive symptoms.
Well, whatever, positive or negative. What are the symptoms of main criteria, major criteria of depression? Three.
Hallucination.
Hallucination.
Speech disorganization.
Okay.
And
ما حاخذك. Delusion. Thank you very much. So hallucination, delusion, and silly behavior. Thank you very much. Who said silly behavior? You are already, you took bonus. Oh, thank you very much. Give him a bonus, Yasin. Okay, Saeed. In order to have, you need to have silly behavior. He doesn't have silly behavior. He doesn't have hallucination. This is why he is not schizophrenic. This is the way of rationale I would like you to weigh your diagnosis. I know that I exhausted you, but you are doing excellent. Usually the people who are, and really very rich, very nice case. Thank you very much for both of you. How you treat this patient? Would you do any investigation before the diamond ends?
For him, I couldn't find any investigation, no.
يا شيخ.
حتى قلبت والله في الانترنت جست احصل انفستيجيشن لدرجه اني سالت اكثر من شخص قبل ليكشر ما لقيت شيء.
I'm sure now.
I mean here investigation regarding to the disease itself, regarding to the general.
Yeah. If you are in front of external examiner and he will ask you directly, you are a medical student, what are the investigations? Very straightforward.
Drugs.
Thank you very much. So you cannot say no investigation.
Yeah, it's regarding to the symptom.
No, whatever. ما هو regarding to his symptoms, he's taking cocaine, he's taking alcohol, and this is just the tip of the iceberg. You don't know what's going on down. This is why you need to make sure that yes, he should have some investigation to make sure. أنا ما عندي واحد حشاش وجاي يعمل لي هو كينج وهو whatever ولا هو المهدي because of cocaine or. By the way, do you think of any other diagnosis?
Yeah, drugs or substance intake.
Substance
Intake.
well, abuse. في something else.
delusion of kind out.
Well, one of the possibilities, like delusion disorder, one of the diagnoses, like a few very specific term.
Paranoid.
It's almost
uh,
delusion. This is the proper term, delusion disorder. But it's very straightforward. Immediately, you should just think about it.
Withdrawal.
Drug-induced psychosis. You need to put it in your differential. Drug-induced. This is another thing. You might have only substance abuse disorder, different kind. Substance abuse disorder is different from substance-induced disorder, induced psychosis. Because this psychosis because of substance. ممكن أنا حشاش لكن ما يصير عندي psychosis. ممكن أنا alcoholics لكن ما يصير عندي psychosis. لكن if I have psychosis and this psychosis because of a drug, it is specific, you know, it is well known. سؤال.
دكتور معلش انا كنا فاكر السبستنس ابيوز ديسوردرز هي نفسها اللي بتعمل سايكوسيس.
Substance abuse.
انا كنت فاكر نفسها اللي بتعمل سايكوسيس. بدي اعطي مثلا امثله هون عشان نعرف.
ممكن السبستانس ما تسوي psychosis. You might be ممكن تكون heroin addict لكن ما في psychosis, ما في hallucination, ما في delusions. Okay, so that means it is only pure. And I would like you to know, كمان مرة I'm حاول إنه I'm avoiding the things regarding the drugs till the drug time.
Does hashash mean drug addict?
Say it again.
What does hashash mean?
Marijuana.
Well, some people said hashish for marijuana or hashish cannabis.
Gotcha.
Okay. عشان الوقت how to treat this patient. So investigation fee. Investigation. How to treat him.
Cognitive behavior therapy. وفي نفس this regarding to the personality and regarding to the addiction. I'm gonna transfer him to the other doctor for the
I think
addictive center.
this is what you need to know what's going on. So cognitive behavioral therapy, one of the, this is interpersonal psychotherapy. Have you heard about this? Interpersonal psychotherapy. You need to, that means it corrects the relationship between you and others. How to be positive, how to be negative, how to improve your relationship with others. This is, they call it interpersonal psychotherapy. Drugs. Would you give him any medication?
The medication will help him to stop illegal drugs that he takes, especially the cocaine and the alcoholic.
ما حمشي يعني حمشي لك إياها لكن it is even would you give drugs to stop the drugs?
I can use the cognitive behavior therapy and advise him to stop it, and I can use the
Please attend till we will reach the drug. The drug session will be very rich. Okay, like this. Would you say something for his relative, social? Look, please listen to me. You need to follow what we have learned. Bio, psycho, social, spiritual. Okay? With personality disorders, you want just go for spiritual more. You can just rebuild the values. You need to be just, well, what is your relation? What is your position in this life? What is your role? What is the life meaning? And this kind of things. So you need to just follow biopsychosocial. Bio, would you give him medication or not? This is very important. Psycho, thank you very much, especially with the person's disorder. If there is no major problem, I will not give him medication. But psycho, I will give, as I told you, CBT or interpersonal psychotherapy. Social, what do you do with the social treatment?
has come to improve his relationship with his family.
This is psychological. Now with family, what you will tell his family?
I can explain his family regarding to his situation. This is a disease. You need to, like for example, accepting him, be a little bit flexible dealing with them. Explain for them regarding to the case and how to deal with it.
Thank you very much. Educating them is the most important thing. So this is, as you said, this is what he has, and you need to be gentle with him. This is his type of personality. Help the psychotherapist whenever he will go through the psychotherapy journey. Would you see him when?
After 1 week. Usually I will give him more time to have a space, but
Thank you very much.